We now have an opportunity to hear from a group of people that have been working in the field of quality, and they're relatively new to the philosophy and lessons from Dr. Deming. And I'm going to invite the Bold Counsel to please come forward and take a place on the platform. And I will do introductions as soon as we have them in place. The Bold Counsel is an acronym for BOLD, although they are also bold in several other ways, because they are beginning their journey in a very recent time period. Some of us in the room, some of the people you've heard from, have been doing this for 5, 6, or more years. But these folks have been pursuing Dr. Deming's work independently and collaboratively is the important part, collaboratively over the last couple of years. And I think their story is something that you all need to hear. But first, I would like to do a quick introduction from the left side of the room. I'd like to introduce you to Phil Yeiter and Phil Kurdunowicz and Brian Barry and Jeff Weefrich, James Bunton, and Wendi Middleton. This is the Bold Counsel. And Wendi, you wanted to say just a word, and if I can, thank you, Jeff. Thank you.
Thank you, Dennis. First of all, I'd like to thank the conference organizers for inviting us to come today and also to be able to attend the conference. It's really wonderful to be able to see and hear from people that we are learning from and reading about and reading the work of, and I've learned a ton just over the past day and a half or so. So we appreciate that very much. Second, I want to recognize some people in the room. Annette Gamez is also a Bold Counsel member. Would you raise your hand, please, so people know who you are? And Ruth Archer, I don't know if you're still here, has worked with us in the past and has been wonderful to work with. And a special thanks, before I give you a little background on what we're working on, to Holly Grandy Miller and Jean Williams, who helped put our feet on the path to where we're going now. So special thanks to them. So the Bold Counsel is a group of folks who work in the area of long-term supports and services. And for those of you who have parents, you might know that your folks need help in their home. They might need some in-home services. People need nursing home care. And so we work in areas to figure out what services people need, how do we get them delivered, who delivers them, how do you regulate them, how do you pay them, and from all different perspectives across a large department and also some folks from different departments. So several years ago, in an effort to fulfill a federal mandate for a grant that then never got funded after that, we decided that we needed to talk to folks in all of the department because we didn't really know that much about each other. Over the past 20 years, long-term supports and services have kind of grown up in silos based on funding source and requirements, and we realized we didn't know each other that well. So we got together and had a meeting and found out just how much we did not know about each other at that meeting, and then decided to start to work together. And that work then turned into applying for a 1-year grant from the federal government to do planning, to do the work that we're doing now. So that's how we got started. So over the past year and a half or so, we have value stream mapped 18 different long-term supports and services. So in-home services for people that are where you have to be Medicaid eligible, or in-home services for people where you don't have to be Medicaid eligible, you just have to be over 60. Services for people with disabilities. Most of our services are designed to keep people who do not want to go into nursing homes out of nursing homes. So supportive services in the home so that they can live wherever they want to. But also if a person needs nursing home care and wants to go, and oftentimes that's a financial issue. They might not really want to go, but that's the only way to afford it. Medicaid is heavily influences all of the services that are delivered. So we value stream mapped all of those 18 supports and services programs and realized that not one of them was without major clunky problems. Not one. 18 processes, 1,800 process steps, 500 barriers, delays, problems, and 722 ideas for improvement. So, yeah, job security for everyone, you know. So we actually have been working with 3 specific design teams. Our sponsors are the leadership of the Michigan Department of Health and Human Services, which is a newly merged department of now 14,000 people, which if you live in Michigan, you've probably heard about in the news. So they selected the first 3 design teams, programs to be design teams based on horrible audit findings. So you can only go up from there, so that's been fun too. So the 3 programs are the My Choice Waiver Program. What that means is you can get nursing home level of care service in your home if you qualify functionally. We also are working on something called Independent Living Home Help, which is in-home services for people who may not be waiver eligible, but are also poor and or disabled and need services in the home, which also help prevent them from going to nursing homes. And then adult protective services, where if you believe that an older adult is being exploited or abused, you call a number and they investigate and then try and help the person with whatever help is needed. So in a nutshell, that's what we've been working on. So we have the 3 design teams. They've been in existence since last October, where they received training. Everybody had the red bead training and then training in how to do the PDSA process and how to operate as a design team. They have accomplished their first PDSA. One was a heavy lift and 2 were not so much. But for us to be able to make change in 6 months is glacial speed for state government. I mean, not glacial speed. The way we normally do it is glacial speed. Jump to light speed, that's what I meant to say. Because policy making and policy change at the state level is a very slow process. And so they've accomplished their first PDSA, now they're working on their second. So I think that's probably enough for background.
Thank you,
You think
Wendi.
so? Okay.
So, not so fast, Brian. I would like to ask a question of each of you, and I ask that you answer it from your own perspective. And I'll start with James Bunton. If you would please, James, tell us what is the greatest lesson you learned from Dr. Deming's work?
Right off the bat, Dennis, we're new. I say maybe we're freshmen in the Deming process, and when Dennis asked the Bold Counsel to consider coming here, I thought in my mind, I said, well, Dennis, we're not as skilled as you are in the Deming process, and your colleagues are going to be there. I'm thinking this in my mind, and what are we going to say? And I continue to look further into the Deming process, and that's what it's all about. You know, everybody is involved in the Deming flow of improved learning philosophy. Everybody is involved, from the beginning to the end. That's what makes this philosophy works. Deming says, you know, what are we going to do to improve strategies and improve things? I think everybody knows what to do, but how are we going to do it? And one of the key things in my division that I work with Michigan Rehabilitation Services, we work with people with disabilities and decreasing and removing their barriers so they can go to work or maintain work. Well, that philosophy, Deming's philosophy, is right there too. He talks about removing barriers that impact the flow or the continuous improvement of services. I learned that those barriers are learning about changing, accepting, continuously improving, paying it forward to your colleagues that come in, helping us remove those barriers to continue that flow of improvement. That's important to make sure that that improvement continues. The thing that I really enjoy the most is that as I begin, that everybody is involved. With us, with Michigan Rehabilitation Services, we work with people with disabilities. There's persons that serve those people with disabilities, and there's persons that monitor those services. Everyone is involved in this. I'm a firm believer that we need to have information from the ground source, from the customers receiving the services to improve the services. This is all part of it, making sure that that flow goes from the people receiving services, the people that are giving the services, and the people that are maintaining the services.
Thank you,
So
Jim.
that's what I learned. Thank you,
Thank you.
Dennis.
Jeff, the same question.
Okay. Couple things for me. I'm kind of the oddball in this group because I'm a psychologist. I grew up in the behavioral health field, and I was brought into this group, and I'm thinking, well, we don't need to learn about these principles. We don't have to do this kind of stuff. I know what people are thinking. We just need to talk to them and we can change. So, yeah, that doesn't work. So that's probably why I haven't talked to anybody clinically for about 12 years now. So, but anyway, the other thing I thought about as we were moving to the Deming stuff is I was questioning how what I perceived as something that's applied in the industrial world can be applied in kind of the human services world. And as we began to look at it and see what was going on, it began to make sense to me. I mean, these principles, you know, they will work. We can apply it. We can make it work. And as we did all of our work and did all our value stream maps, probably the biggest principle that stood out to me was, you know, breaking down barriers. In our case, it'd be between departments. If anyone's ever worked with state government or even seen an organizational chart for state government, you probably realize that we have a department to manage the Department of Redundancy Department. And I guarantee each one of them will say they have a special job that no one else can do, and they have to be the ones to do it. So, I mean, as we were working through the maps, it became very obvious that we're trying to provide a service to people, long-term supports and services to people. And we had all these different groups of people trying to do the same thing, all with very good intentions, but we weren't talking to each other. We didn't have any idea what these other agencies, what these other groups were doing. So it became very apparent that we have a lot of barriers that we need to break down. And for me, that's been the biggest part, because being in the behavioral health world, we've always been perceived as being on kind of the outs of some of this stuff. And bringing that focus in and realizing where we fit in and what communication we need, it's a real benefit, because the behavioral health component of long-term supports and services is very critical, and we want to be actively involved in it. So I'm looking forward to continuing the work and making sure that we no longer work in the silos that Wendi talked about. Because anybody that's ever been in a silo in this room, anybody ever really been in a silo? Stood in there and look up, it's a lonely place.
Thank you, Jeff. Brian, same question.
Well, I've been working for the state now for 25 years, and as Wendi often points out, this isn't our first rodeo with quality change and looking at our programs and processes. But this one is, when we started applying Dr. Deming's principles to what we were doing, you could really tell the difference, that the change in what we had ever done before was palpable. It was tangible. And I think one of the concepts that really resonated with me was the idea that every process is perfectly designed to produce the results that it achieves. And so when we looked at the 18 programs, we recognized that what we were seeing wasn't being done by accident, that we had actually designed this system. Now, really design that system is probably a misnomer, that most of these 18 programs have been redone in response to audits or other quality initiatives over the years, and the response was always to put a Band-Aid to fix the problem, that you never looked at the underlying processes, and frankly, we never looked at the overarching system of how we provided long-term supports and services to the people of the state of Michigan before. And so in any given program, we had this mass of Band-Aids. There wasn't a program there, it was just a ball of Band-Aids. And it formed a Gordian knot that we're slowly trying to unravel. And so one of the first things we did is my friend Phil here did an environmental scan or a chart of all the programs, the processes, the touch points, the funding, the regulatory authorities, and it was just an incomprehensible mass of lines and boxes. No, it was good, and it really drove home the point that for the people we were trying to serve, the experts couldn't navigate this system. so that people that were coming to the system, often in crisis, had no chance of really effectively navigating it and getting the services that they needed. And so I think that we're slowly applying it. I will point out, in the sake of transparency, that we may look like this group, we're forced to wear ties and whatnot today. We don't, while we take our purpose very seriously, we don't take each other very seriously. We're the one group you might ever need that has safe words during our council meetings. And if you laugh, you know what that means. And we've adopted as our motto a flatulent unicorn with lots of glitter. So the purpose is very important, but we're very unified in our approach.
Thank you, Brian. We'll later come back to the rule that got you in that direction. Phil K., would you share your learning from Dr. Deming, please?
Sure, but I actually like to start with a question, and the question is, how do we know we're making good policy? And I think that's something that the council has discussed extensively. So when I talk about policy, I mean a proposal that once we enact it, it makes a significant change in the structure or operations of our programs. And I think our first attempt at addressing that question is actually when I used to work for Brian. We were working on dashboards and trying to define quality outcomes. And the challenge that we faced is that when we create new policies, it's not a simple way to measure the quality of a policy. You don't produce policies per hour. That's not a very effective, metric. And while we went through that, we eventually were able to come up with some long-term quality outcomes, but it was difficult to tether the individual policies and their quality to those long-term outcomes. And so we needed a different way of thinking about it. And so through this process, we started to look at not necessarily the outcomes of the process, although the outcomes are important, but look at the process itself of how we made policies. And as we embarked on this bold adventure and started to look at our process, we saw a common trend. And the trend is when we look at the quality of our individual policies, we have a number of steps where individuals inspect those policies. So we have a step where management takes a look at that policy and determines, okay, is it okay to move forward with this policy? We have a public review process where external stakeholders get a chance to chime in. And then there's always the audit process, which takes a look at the quality of our policies sort of longer term. But those methods, we face challenges with them because, for example, with management, how does management always have the context they need to make sure, as they're approving policies, to make sure they're making good decisions? How do they have all the information they need? In terms of external stakeholders, we bring them after the policies have been developed, but by the time the policies have developed, we might have missed nuances, we might have missed priorities from our communities, whether it's consumers or providers. There's a missed opportunity to engage our partners out in the community. And then in terms of the audit process, auditors play a very important role, but they can really only help us identify problems. They can't help us fix those problems. In order to fix those problems, it really requires the work of our staff. And so that common thread there is we had a very strong dependence on inspection in terms of producing quality. And as many of you know from Dr. Deming, we can't rely on inspection. So we had to think about a different way of evaluating quality and trying to build quality policies. And I think that's something we learned from our design teams just watching them work. There were a few strategies that they used. A strong emphasis on collaboration across areas. As you can see from the council, we're really starting to bridge those gaps across the different areas of the department, but not only within the areas of the department or different agencies, but we're starting to reach out to our external stakeholders, whether it's consumers, providers, service agencies. Can we bring them in at the front end and have those discussions to make sure that we're meeting their needs and that we're building quality on the front end? Also the use of data analysis, evidence, and pilots. This might surprise you, but most of the time our policies go out, we don't test them. We sort of just we promulgate them and then evaluate once we put it out there what the impact is. But based on number of angry phone calls. But if we were actually try piloting those policies, which our design teams have started to do, we would be able to detect quality problems before we go live on a statewide basis. And the last thing is open communication across our departments and agencies, across different areas, and with our stakeholders. And now that we've had a chance to test those methods with our design teams, something we're working with leadership on is how do we build that into our overall policy process? That it's not just with these design teams, but every time we do a new policy proposal, how can we apply those strategies and those Deming principles to make sure we're building quality policies? So I think the thing I learned the most from Dr. Deming is that we can't rely on inspection, that we have to build quality in on the front end through different methods.
Thank you, Phil. And Phil, why?
Good morning. What I've most learned about Dr. Deming's principles and philosophy, I kind of, as we thought about it over the last couple of weeks, knowing that we're coming here, is I think back to the rifle range in the Army, and you have all these different targets on the rifle range that pop up at different times, 50 meters, 100 meters, 250 meters, 300 meters is the furthest. They pop up together, sometimes they pop up differently. The end goal is a 300-meter target, but we could become so focused on the 50-meter targets, whether it's a result of auditing, result of management-driven, we just hit those 50-meter targets and you always miss the 300 because you're not forward-looking. What I get from Dr. Deming, from the philosophy, from lean practices, is that you always have to keep your eye on that 300-meter target. You have to have that in your vision. If you lose focus of that, you'll never hit it. The tools that are provided allow you to knock down those targets, those 50 meters, while you're still looking forward. So that's really been my biggest aha moment, is that you can apply those principles from the 7 deadly diseases, from the 14 points. They all affect the whole system, whether that system is short or long. If you're not looking long term, you'll never get it. So,
Thank you, Phil. And last but not least, we're back to Wendi. What is your learning from Dr. Deming in this process?
The thing that has impressed me the most, and maybe just because I've been the closest to it in the last 5 or 6 value stream maps that we're doing ourselves, is that pride of workmanship. State employees get a really bad rap, really bad. And again, it's not because they're bad, it's because the processes are terrible and no one pays attention to them and no one tries to fix them. And going through this process, it is a wonder that anybody gets a service in some of these programs. And they only get that service because somebody climbs a mountain every single day for every single client in this clunky process with workarounds all over the place in order to get them the services that they need. And we've seen some really interesting interactions between state-level staff who have the book of the process and what really happens at the local level. And some very interesting dialogue back and forth between, I know that's what it says in the book, that's not what we do, because if we do that, they don't get services for 6 weeks because you people take too long to approve it. So we do this. Well, that tells you that your process is bad. It's not working properly. So what I've noticed is the folks that come at serve as subject matter experts, and we've now worked with over 100 of them in different programs and processes, they are liberated by this process. Finally, someone's asking them, what is wrong? We do the as is, and what is wrong with this process? That's their favorite part, the barriers, right? So they are empowered by that, and then doubly empowered by, how would you fix it? What's your idea for improvement? And with 722 ideas for improvement for just the first 18, there's a lot of knowledge and skill and technical expertise out there that does not get tapped. So to have people leave and say, thank you for asking me what I think, is a very rewarding thing, but a very sad thing at the same time. So people want to do a good job. It's our job to help them do a good job by not subjecting them to these horrible, broken processes.
Thank you, Wendi. In preparation for taking some questions from the floor, there's one more question that I'd like to ask each of you, and I'll start with you, Wendi. And that is, if you would share a story that's illustrative of your learning. And Wendi, I'm going to prompt you with the story you told me the first time I heard about the work of the Bold Counsel and the case study of two humans, senior citizen and an
Oh.
adult child
Yeah,
with
yeah.
a disability.
Yep.
Would you tell that story?
Yes. So the first thing we did to start this whole we didn't even know we were really starting this whole process, but the first meeting we had with representatives from all of the different long-term supports and services to talk to them about we need to talk to each other because things aren't coordinated and people aren't getting services and we have all of these redundancies all over the place. We had people come together at round tables and we broke them up so that you were sitting with people that you didn't work with every day. You didn't already know what they did. And so we used a case scenario from our office. One of our service providers shared with us. It was an older adult woman and her younger adult daughter who had a developmental disability, and they had a cat. So we said to these tables full of people, how do you help this family? Well, who's on first? Nobody knew, right? And I remember the guy who used to be the head of MRS was at my table, and somebody said, Michigan Rehab Services, somebody said, well, you guys do housing, right? So maybe we should start with housing. And he said, we don't do housing. We're Michigan Rehab Services. We help people get jobs. And I, oh, okay, that's a problem. So, you know, the conversations went on and on and on, and we couldn't figure out who's going to do what here, when, and how, and we didn't know enough about it, but we all knew what to do for the cat. No problem for helping the cat. So that was like, whoa. And that was the day that we all signed a charter that we're going to start working on this because this is ridiculous and we can do better for the people of Michigan that need our services.
Thank you, Wendi. That is the exact story I was thinking of.
I'm so glad.
Yeah, James, would you share a story?
I have a quick one regarding providing services to persons with disabilities. We have a system that we work with when people need transportation. Sometimes that transportation is pretty expensive when you have to accommodate a van, and it usually runs between $80,000, somewhere between $120,000 to get the accommodation right. One of the things that our counselors were hesitant in doing is going out to the vendor and getting an eyeball view of what's going on. And before we spend that money, because the customer that's receiving that accommodated van has to know that it's working, know that the accommodations are working, but most of all have assurance and people to contact when they're out on I-94, they pull off on the rest area to go to the restroom, they open the van, the ramp gets halfway down and it stops. What happens then? What do you do then? Who do you call? So we've implemented with our counselors, you know, to make sure that you go out there, that you find out those things and you have that information for those people. So if something like that does happen, they have a resource and a contact place to go.
Thank you, James. Jeff.
Well, I don't think my story's that exciting, but it's kind of goes back to the behavioral health component of the world I live in. In the various value stream maps we do, we go through the process and we talk about the different needs of people. You know, what do we do here when this happens? What do we do here when this happens? And it's been shocking to me about when people have those behavioral health needs that no one knew where to refer them or no one chose to make any appropriate referrals to essentially any behavioral health service to address those because no one knew what to do or they didn't want to go through the process because they didn't want to essentially insult the individual for recommending any behavioral health services. So that's kind of where mine has been in this process.
Thank you. Brian.
We came to the conclusion early on that, or recognized early on that when you're talking about long-term supports and services, most often you're talking about Medicaid, and that's really where I come from. Most of the 18 processes that we mapped were, I must admit, my processes. But in my defense, one of our design teams that Wendi referred to on the My Choice program really took this process to heart early on, and they sat down with their content experts and recognized that the one thing that the people in the field wanted us to address was the access to non-emergency medical transportation. Now you have to understand that non-emergency medical transportation, or we refer to it as NEMT services, have been available statewide for years. But the process has developed that in order for someone to go to get a ride to their doctor's office, it would take them often weeks to get the authorization to do that. And then very often you had different silos providing different aspects of that, to the extent that we would get stories of people who had to go get a specialist or see a specialist in a different county. They would get a ride to the county line and have to wait there for hours for another provider to come and pick them up and take them, and then they'd have to reverse that going home. So our My Choice design team said, we've got a waiver program that coordinates care management, and why don't we make NEMT services part of that so that we could gain the efficiencies, and instead of having all these different handoffs with this authorization and the service provision, it would all be part of their normal care plan and case management and oversight services. And the previous speaker this morning was talking about the use of spurious statistics. They calculated that we would achieve a 62,000% increase in efficiency through this process. That rather than it taking weeks, it'd be a matter of minutes. And so we've grabbed onto that, and that's been our selling point. But the fact of the matter is, as we have put this improvement together and started to implement it, and again, we're actually piloting this in 5 different areas, and each area is allowed to use the process that they think will work best given the providers in their area, so that we can come up with data and best practices on how we can roll this out to the waiver program statewide. All of a sudden, all of the other long-term supports and service programs are saying, wait a minute, we want in on this too. We want our people to be able to get immediate authorizations and have that coordinated approach. So all of these other programs, including the basic state plan service, are waiting to see what we learn from our pilot programs that our design team came up with, so that we can improve the service statewide.
Thank you, Brian. Phil Kurdunowicz.
Actually, I was wondering, is it okay if I tell 2 stories? Because I was going to tell one originally, but while I was sitting here with you, I thought of another one.
Sure, please do.
Okay, so the first story was actually before we went on this endeavor, and it was when I was riding with the former Medicaid director on a way to a meeting, and I was talking with him about different developments in the state and different things I heard on the news, and he's like, where did you learn that? I'm like, well, I read it in the news. And he was a little bit surprised because he wasn't used to getting questions from staff about things that were happening around the state or in different areas of the department. And he said, I wish staff knew it was okay to learn and explore. And that just struck me as I was sitting with you now, and that it was something that I don't think it's communicated very often through our department. I don't know about the other agencies as well, but that staff, it's okay to take time during the day to learn and understand what other areas are working on. So that was the story I thought of while sitting with you. But the other one is while we were working with the design teams, we have weekly stand and deliver meetings. And at first, everybody isn't happy about another meeting every week on your calendar. But the thing that we started to see as all the design teams started to come to these weekly meetings is they started to share and they started to collaborate. And much in the way that Brian was describing, that much of the learning didn't take place from the council to the design teams, but between the design teams. Not only ideas for improvement, but strategies, the staff started teaching each other how to use Excel in different ways and things like that. And that was really an amazing thing to see, that most of the learning happened between the design teams rather than just being sort of taught to them by the council.
Thank you. Phil Yeiter.
So I work with our state veteran homes through the Department of Military and Veterans Affairs. And in Grand Rapids, there's a lot going on with the veteran home there, if you're aware. So everything we've been focused on at our agency and department now has been to correct the system. How do we fix the system? Yesterday, I learned about rock logic and water logic, excuse me. And so recently, you know, the legislature we work with a lot, and they're obviously very invested in the veteran homes. And each legislator has their own unique vision of how we should operate and how we should fund and how we can fix it. Everybody wants to come to the rescue and drop legislation and change the law. And so recently, one legislator introduced a bill that said, we're going to license you as nursing homes. And we said, we're not a nursing home. Well, you kind of are, so that's what we're going to do. So he's using rock logic to say, all right, you're a nursing home, you've got old people, so you're a nursing home. So we went back and talked with him and said, okay, and I learned this yesterday, applying the water logic, how does this fit in, where does this go, you know, how do we get there, where is this coming from? We can understand, you know, that's fine and dandy, sir, but we actually have to change the widths of our hallways to become licensed as a nursing home. There's a lot more to it than just at face value. So rock logic versus water logic, that's my most recent example.
Thank you very much, Phil. I'm going to ask one last question. There's a story I was hoping somebody would crank out. And I heard this story about what happens if people are under the care of a state department or the local agency and they should die while they're under the care of a caregiver. Would you share that story?
Sure. So if you are receiving Medicaid services for many programs and you die, you get a letter after you're dead saying that you died and you're no longer eligible for services. I'm sure you don't care because you're dead, but it's a horrible thing for your relatives to get, too. A letter from the state saying we understand that you have passed away. Yeah, so we found that out, and I think we've stopped that most places. Yeah.
Well, the part of the story that I found most remarkable is on questioning, you discovered that the practitioners who were present, at least,
Yeah.
didn't actually send the
Right.
letter.
Some of the folks that were part of that value stream mapping group, the subject matter experts, they said, we just don't send it. Yeah, we know we could be audited and get in trouble, but we just don't send it. That's so cruel. And it's like, and we're like, oh, I mean, can we stop sending letters to dead people? For God's sakes. How hard is this? Yeah.
And it seems like it was 56,000 times a year they were, by state policy, supposed to send it.
Yeah.
But the general consensus was nobody sends it.
Yeah. There's I have this picture in my head that in the past, at least in our work so far, policy has been made at the state level by a couple of people getting together in a closet, you know, hey, let's make some policy, you know. It doesn't really happen that way, but that's how I envision it. And then they go, they just shoot it out, and then phone calls and letters, and people are all upset. Well, we're trying really hard to change that, and I think we could have avoided that one if we'd used the methods that we're using now. We're doing what? Sending letters to dead people. Okay. Now, understandably, there needs to be some services now end. How about just a little note in the file in the computer, deceased, you know, stop paying, because that's really what it's about. It's like payment is no longer going to happen. Well, of course not, but anyway.
Thank you for the stories. I've got to ask now questions after you've heard these stories of what they've learned from Dr. Deming's work. I'm going to get Mike first.
So you said that you developed some ways of monitoring quality on your process. Do you have an example of that?
Well, I should first ask, do you mean the improvements that are being pursued by the design teams, the individual improvements for the program, or improvements in the policy process? Sure. Well, the design teams have started to track metrics with the policy changes that they're implementing, which is a big deal because many of the policy changes that we have historically put out haven't necessarily had metrics tied to them. You know, we implement the policy, but how do we know how effective the policy is? So that's a big change in itself. In terms of the policy review process, we're still working on implementing it. So part of it was we were still learning from the design teams what works in terms of strategies, so that way we could build it into the way we look at new policies. And our hope is that as we have learned from our design teams, that we can encourage those practices in all staff across our programs. So we're still working on how we evaluate the change policy review process, but that's something we're hoping to accomplish.
Mike, thanks for the great question. Oh,
Actually, if I
Brian.
could, I think it's a relevant question because when we built these design teams, we wanted to start them with we wanted to give them a success experience with their first PDSA cycle. And so now most of them have progressed to their second and even third cycles. And with the Adult Protective Services group, Wendi and I just started working with them and asked, well, all right, where do we want to go for our second PDSA effort? And they said, we really want to do quality improvement. We don't have anything in the system that addresses quality improvement. And so we said, oh, that's a good one. What do you want to, what would that look like, or where we go? And we learned very quickly that there was absolutely no definition of what constituted quality. And so in their minds, quality was doing case reads, supervisors sitting down with a stack of 300 files and doing case reads. But it had nothing to do with what they did with what they learned from those case reads or anything like that. So we said, well, let's develop that system. First question we have to answer is, what is quality? And so we're in the process of asking the clients and the people in the field that deal with these cases, what is a successful outcome in this program? And that's such a new concept for them that it's like a light bulb went on. Wow, let's really find out what constitutes quality, and then we can implement that.
Thank you.
Can I add one tiny thing? I love Gene Williams. Where are you? When we started working with Gene, we did three just process maps of 3 programs, and Gene said, well, where are your outcome measures? What are your outcome measures? And we all went, they got a service. And at the time, that was it. They got a service. Yay, they got the service. So we've learned a lot from Gene and from the folks at MRS, but that was a big eye-opener because it was like, we feel so happy if you got the service, There's so much more.
Thank you. We have another question.
Well, as an older citizen in the state of Michigan, I would first of all like to thank you for your efforts. I'm sure Dave and I are probably not far from applying for some of your services, so at any rate, thank you. But I was just wondering, often people in organizations are afraid to offer up improvement suggestions for fear of losing their jobs due to increased efficiencies. And I wonder if you've faced that and how you're dealing with it.
We have been very clear from the beginning that any savings realized will be reinvested in the long-term supports and services system. So we never talk about cost saving. We rarely talk about cost savings. We talk about increased efficiency and giving you more time to do the other parts of your work, that are just as important as you trying to climb this mountain every day. We really stay away from framing it that way. And so far, that's been effective, mostly because all of the programs that run, all the people that run these programs, they're all understaffed all the time, which results in a lot of audit findings, right? So, audit findings are not terrible, but they're great if you're trying to improve things.
We have another question or two.
So as a result of this, how have you understood, what would your customers say about this? With the results that you guys have achieved, what would be their talking point of, hey, I got this service and this is how it impacted me? And are you measuring that in any way?
Yeah, most of the services have a requirement that you do customer satisfaction surveys, not all of them, but most of them do. We already know with the non-emergency medical transportation, they're going to be so happy because they don't have to predict when they're going to get sick to try and call several weeks in advance to get a doctor's appointment, for one thing, right? So we're expecting really good results from customers on that, as well as the people who implement the program at the local level, because those are both equally important to us.
Thank you, Wendi.
How are the surveys done, and how did you compile them?
The Bold Counsel has worked with each of the design teams to develop these surveys, and the way it's typically conducted is we work with the field staff to get in contact with consumers and ask them a limited set of discrete questions about what's your current experience, what would you like to see improved, and then the design teams compile that information. I don't know if that necessarily answers your question, but does anyone have anything to add?
Ideally, you would have people who are not involved in providing the services do that. Yes, that's a funding problem. Yeah, always a funding problem. No. I don't think so. I think it's mostly, we just don't have the funding to get an outside group to do that. And the design teams are very aware of the potential bias in that process, and so they often try to switch off and have someone who's not your case manager ask questions. But, you know, you're always going to have people, no matter who asks the question, they're going to think, oh my God, if I don't answer this in a positive way, I'm going to lose my services. It's hard. It's really hard to get around that. They are the vendors providing the services. Yep, in many cases, yep. Just depends on the program.
Thank you. We have another question.
Thank you for being public servants. I appreciate that, and I'm sure we all do. So thank you for everything that you do, first of all. 2 questions, both on sharing. How do you share all the successes, maybe similar to your stand and report or stand and share among other agencies within the state? And then also, how do customers like myself know about all the positive things that are happening in the state with improvement?
Okay, so we've just put together a newsletter to go out to all the people that have been involved with us so far. It hasn't gone out yet, but it basically chronicles what's happened over the past year or so. We have our own stand and deliver with department leadership, our sponsors, so we do that on a monthly basis so they know what's going on, and also if we need help, you know, with getting rid of barriers or whatever it is. We have not done a good job of talking to what's happening to other departments. There is an office called the Office of Good Government, which I think is going to be, we're going to be communicating with them. They're going to share the information with other state departments. So, but it's, you know, it's a lot of people. It's 55,000 people. So, the citizens, we have not really even thought about that too much. We're happy when our customers are happy, you know, the people who are actually getting the services. But it's a good idea. It's a great idea. Yes, Holly?
I love your question. I'm Holly Grandy Miller, and I'm with the Office of Reinventing Performance in Michigan. And we're launching a website that will have lots of these stories coming up in probably a month or so. If you Google RPM, State of Michigan, you can start seeing some case studies of process improvement or changes in state government. And so we're meeting with Wendi to get the background on their story and to try to highlight that. I came from the licensing side of government, and how we reached out to the common citizen, or I shouldn't say common citizen, but citizens, was we focused on like the business community and went to business councils and shared. So they have a lot of sharing they need to do with their own constituents, but we also need to do more statewide sharing. Anyway, sorry.
Thank you very much, Holly. Jacob has a question.
Just going off that same question, it seems like you have a really good, small team, which I think was a point that was emphasized earlier, to really be able to work with things. But how have you kind of built out the culture elsewhere? Has it been, department-wide communication within those own teams? Kind of what level has it targeted, and how much did you guys, coalesce first before moving the message out?
I would say it's a stealth move within the department. We do what we do, and people learn about it as we work with them. We have not done like big time presentations or anything to people, because long-term supports and services is such a huge area. I mean, we work with folks in the department that are in charge of IT, in charge of the Business Integration Center. So we have contacts with different parts of the very large department that we're going to be interacting with, where the state is developing or piloting an integrated service delivery system that is really interesting. So we want to be ready when it's time.
No, I didn't want to cut you off. I think it is a good point that you have to understand the enormity of the department in which many of us work. The Department of Health and Human Services is responsible for half the state budget, but we are working with so many elements that are doing similar things within that department. But it's also, we're experiencing, as we get more down this path, a lot of spread, that the word gets out, and people are coming to us, and department leadership are saying, all right, we want you to tackle some improvement processes in these other areas, even though they don't necessarily pertain to long-term supports and services, but in other areas. So even within the department, the word is starting to spread, and they're starting to come to us for kind of advice, like we're the experts. We're just starting down this path ourselves, but it is slowly seeping out into other areas.
Thank you.
Well, and another thing is that we are one quality improvement initiative. There are actually multiple quality improvement initiatives occurring within the state of Michigan right now. And something that's been a conscious effort by the administration is trying to cultivate the capacity within each department and agency to do quality improvement, so that there are dedicated staff that are working to spread the culture throughout the state of Michigan. Holly's team does a ton of great work with that. So it's exciting.
Yeah, I would second what Phil just said, and that the statewide we're working on that. Within our agency, I specifically with the Office of Good Government, we're going right down to the subject matter expert, to the basic service provider, and working with those teams, whether it's in our state veterans homes, whether it's a nursing team or the admission team or the accounting team. We're working with them on just basic principles, value stream mapping their processes, identifying those impediments, trying to remove the barriers at a very basic level, tracking that success, tracking those performance measures and metrics to show results. And you see it slowly spread. It's infectious among the staff once they get it, once they understand it. It spreads out, and we have other departments saying, hey, we want to do this. The doctors just came and said, we want to work on this. We have stuff that's wrong, and we know it, and we want to visualize it. We want to be the guys with the stickies. We want to come to your room. So it works at that very low level.
Thank you very much. I'd also like to point out that Holly, who you met, is a graduate of the CQI Academy. And I want to make one more plug. We have the next academy starting on Tuesday, just 2 days away. So see Eric or Adrian or me. We'd be happy to fill you in if you would like to sign up. We do it twice a year. And you heard about the square root helping us develop that critical mass. And the number 12,000 people out of 110 people who are part of this conference. They're not all in the room this morning, but we all have an opportunity to make a difference and spread what we've been learning. So, what other question? I think we have one more question room. Joseph.
So yesterday we heard from Kintaro about really using the right aim for technology. And are there any technologies that you use today and are thinking about using in the future to really aid you in any of these processes. Specifically, I'm thinking of kind of outdated government websites. How can people really have access to these services openly?
Thank you, Joe.
So I think technology has been a very core aspect of this project, and it really starts with the idea of information sharing. There's a lot of frustration among citizens that they go to different programs, they're trying to get help, and they have to tell their story multiple times. And what they really want is the state government to be able to work across the entire enterprise and just share information, so that way they don't have to tell their story and go through 1,000 assessments. Death by assessment. So many times. Actually, Holly's a really good story about that. Yeah. A key, one of the key projects that the administration is working on is called Enterprise Information Management. And the idea is we're taking a look at all the information resources within the department and trying to work towards an enterprise management for them, and seeing if we could leverage common systems across multiple programs. And so there are different IT applications that have been developed for one program that we could potentially re-leverage with other programs. And I think that's a keen interest, is seeing if we can leverage those IT systems, not only to share information across the enterprise, but also reduce duplication, because one problem is sometimes that happens is one area builds an IT application and another area builds a very similar IT application. And so now that we're moving towards this enterprise and information management strategy, we're going to hopefully reduce that duplication and improve information sharing.
Thank you. Oh, Wendi, you have an answer too?
No, I just want to make sure I have it so I can say something before we're done.
Okay. I think there's room for one more question if we can get a very fast answer. Who has one more question? Thank you. Don.
So I hear that you have looked at the customer and you're including them as part of your system. How wide do you look at the customer? Do you include their family caregivers or friends or anybody like that? Do you view them as part of your customer as well?
Thank you, Don.
Yes and no. We practice in many programs in the state something called person-centered planning, which is the person who's trying to help you figure out what services you might like or need sits down with your family or whoever you want to have as part of that circle of support. And so that work is really done at that level. We mostly, at this point, are working with consumers, but sometimes the family members also respond. It just depends on the program. And older adults have the right to not have family and friends involved in things. That's a very basic tenet of person-centered planning. So we don't force that. If you want to, you can. But we mostly survey older adults themselves or persons with disabilities themselves getting the services. Yeah. Yeah. If a person has dementia, that's a different story entirely. Yep.
Thank you, Wendi.
Yep. So the thing I wanted to say before we leave is we never said what BOLD stands for. Okay. So it's Building Options for Long-Term Supports and Services, LTSS, decision-making, so we could use the D. So B-O-L-D, BOLD. And Annette also says we are the Be-Old Council, because if you get enough services and you're lucky and you're healthy, you will get to be old. And that is the goal. Or die early, it's up to you. But being old is better than dying early, right? Right, okay.
Excellent. Thank you very much. Thank you to all of Bold Counsel. I really appreciate the work that you're doing, not only to share what you've done here, but also the difference that you're making throughout the state because of the work that you're doing, because people are learning from what you're doing and they're asking for help. I just can't get that image of your logo out of my head. So. All right. So we're getting ready to take a break.